Assalamu alaikum wa rahmatullahi wa barakatuhu, our beloved viewer on the program Health Check. It's a program where we give you medical advice in as far as the good living of our health is concerned. And today we're still tackling or looking at the diseases that are affecting the eyes. In the previous episode, we looked at the amblyopia, and today we are going to look at Ametropia. What is ametropia? According to the research I have and the facts about the disease, ametropia is the medical term for the presence of refractive error in the eyes. It occurs when the eye is not able to focus light rays from an object directly onto the retina to provide a clear image. Ametropia includes refractive error due to myopia, hyperopia, and astigmatism. The investigation, ophthalmology and visual science in September 2003, it indicated that a total of 5,599 children living in Africa in 2,712 households were enumerated. Now, basing on the high percentage of ametropia, it puts a worry that we went down to look for a senior ophthalmologist to help us create awareness in our viewers, and that is none other than Dr. Abubakar. You're most welcome once again.
Thank you very much.
Again, we shall be having an eye specialist, clinical officer, that is Brother Hussein Chiinji. He will help us still go and understand this topic of discussion today. And I go straight to our doctor, that is Dr. Abubakar, with the question: how does ametropia affect people's lives?
Thank you very much for the question. And thanks, dear viewers, for sparing time to learn about eye health. And we hope that you will be of benefit wherever you go. Ametropia is a medical term that describes a disorder of our eyes that results into poor focus or bad focus of images onto the retina. As I told you earlier in previous programs, that our eyes are meant to focus images from the environment to the retina, then the brain interprets the images and makes sense out of them, and you see. So if there's any problem that leads to a less sharp image on the retina, that's an ametropia. That's a refractive error. So ametropia actually is very common, but because most of the eye conditions are not painful, we don't see many people having or wearing glasses. Before I go further, some of the people who live in the Western countries, when they come to Africa, they are surprised. They don't see many people wearing glasses, spectacles.
Yes.
And one of them said, wow, I think Africans have very good vision. But honestly, most of us have refractive errors. Most of us have ametropia. I think it's about the economic situation we live in.
Yes, of course.
Most of us cannot afford glasses. Most of us don't go for eye checkups. We live with ametropia and we move on with life.
Life is okay after all.
Me at my center, at the Optic Care Center, we see many patients. And someone grows up to university and they are not aware that they have myopia, they are short-sighted. Until someone is told to sit very behind in a lecture room. That's when they say, hey, I can't see the screen, I can't see the whiteboard. Or if they drive you in their car, on a new road, they keep on apologizing after hitting the humps.
Yes.
So they see the humps when they get closer to the humps. So refractive errors are very common. Ametropia is very common, and it's due to failure of the eyes to focus well. So someone has blurry images, maybe for distance or for near or for both. So ametropia is very common actually, but most of us don't go for eye checkups, so we don't know if you have a refractive error. But if you visit one of the eye centers or eye specialists, they will check your vision and tell you whether you have good vision or you have ametropia.
Okay. Thanks a lot, Dr. Abubakar. In my definition of the facts I had about ametropia, you had me talking about myopia, hyperopia, and astigmatism. So may you please identify what really causes these three?
Thank you very much. The viewers, I think, may be confused about these terms.
Exactly.
It is upon us to make them a bit softer so that they can appreciate.
Yes.
The next time we talk about myopia, someone knows what it means. If we talk about hyperopia or hypermetropia, they are in the same, we are actually together, moving together. Astigmatism, something very, sounds queer.
So let's identify myopia first.
So myopia, hyperopia, astigmatism, these are types of refractive errors, types of ametropia.
Okay.
If someone is myopic, it means they don't see things far clearly. Anything beyond 6 meters and beyond is blurry, okay? And socially, this is not nice. For example, if you have a friend and you've been together in primary and then you're on the street and says, "Hello, Bashir," and you can't see them, they may think you're arrogant, you don't care about them, yet you're not seeing them waving to you. Until someone comes close and says, "Hey, Bashir," now I can see Bashir. So someone who is myopic does not see things that are far, but they are very good at seeing near things. Surprisingly, for myopia, many of them survive up to when they die sometimes without noticing. Why? Because in myopia, most of the things we do in life are near things. Reading, eating, even walking.
And one by one, before we go to hyperopia, what causes myopia?
Myopia, there are many causes, but one of them is genetic. It is common to find a family that has everyone short-sighted. So you can inherit myopia from your parents.
Okay.
You've seen families where everyone is having glasses. So one of the causes is genetic. Because myopia, someone who is myopic, they have actually big eyes. They may look small outside here, but they are longer behind.
Okay.
So the image is formed in front of the retina. So anything that is far, they can't see it well. So one of the predisposing factors is genetics. You can inherit from the parents.
So it can be transferred genetically?
Yeah. Okay. That's the most common cause of myopia.
And now let's go to hyperopia.
Hyperopia is long-sightedness.
Okay.
Now this is different from myopia. With hyperopia, if someone is young, things that are far they can see them easily, but those that are near, they find difficulties in seeing them. However, if someone grows older, for both distant and near objects, they have difficulties in seeing them. And for them, unlike in myopia, in hyperopia or long-sightedness, they have actually symptoms. For them, actually, they get eye strain, they get headaches. Life is not easy. Okay. If it's a child, they even hate going to school. Whenever they are reading, because it's near vision, for them, anything near is difficult.
It's a problem.
They strain so much in reading. So a child may have hyperopia, and they hate going to school.
Okay.
You may think they don't like school, they are very lazy, but whenever they go to school, they get serious headaches. And this goes down if they rest. So even adults who have hyperopia, they always have headaches. They strain so much. Unlike in myopia someone is okay most of the time.
And sometimes they don't even identify that they have myopia.
Yeah, but for hyperopia, life is very difficult for them.
Okay. Doctor, now let's go to astigmatism.
Astigmatism, now this is a very tricky term. In astigmatism, the shape of the eye is not uniform. So some parts of the object have, they form a very funny shape on the retina. So we call it refractive error at an angle. The eye is not uniform, not uniformly formed, the cornea, that helps in focusing. So something that is round, you see it as oval. Okay, something that is straight, you see it as if it's slanting or something.
Bending.
If someone is tall, you see them as short. And for them, they also strain so much. For them, if you're reading something or looking at something, you actually can focus for some time, but then after some few minutes of focusing, you lose your focus. Things become blurry, they lose shape, and you like, is there something on my eye? And they also have symptoms like in hyperopia. They get headaches, they get eye strain. So that's astigmatism.
Okay, thanks a lot, Dr. Abubakar. But this program, remember, it is for the benefit of our viewers that we introduced this program. So we need to see their views. We need to know what questions they have or any views regarding the topic of discussion today, which is ametropia. And this takes me to Brother Mugisha Umar, who is responsible.
Thank you very much, Brother Bashir Nambali, in the studio with the doctor who is helping us to educate most of the people. And Mugisha Umar here on streets of Makerere, and I'm trying to come up with the ideas, the questions that some people who are passing by may have. And I'm not going to take long to pick up one of the people that are passing by and see. Hello, sir.
Yes, sir.
My name is Umar. Could you tell us what your name is?
My name is Onjiga Hamidu.
Yes, we are talking about refractive errors. And we would wish, in case you have any comment, any question, anything to ask the doctor, you can please go ahead and speak to us.
Okay, I may have a question. Are refractive errors genetic, and can they lead to total blindness?
Okay, the doctor is going to answer to you.
Okay, sir.
You're welcome.
Thank you, sir.
That has been that gentleman, and you have heard his question. I'm now going to look around and see whether I can get another person and ask him about what we are discussing. I see this gentleman here. Hello, sir. May I speak to you?
Yeah, it's okay.
Yeah, we are talking about refractive errors. Do you have any comment or question about this disease?
Yeah, because I've been having my question is,
Yes.
yeah, can a person who uses a computer or phone can suffer from refractive error? Is it possible?
Okay. The doctor is going to answer you.
Okay.
I think we shall meet next time.
Okay, sir. Thank
All right. That has been also our brother who wants to know that if a person takes long using a computer or a phone, can that person suffer from refractive errors? I have been Umar Mugisha here on the streets of Makerere, and I'll be back to you, Bashir Nambale, in the studio.
Yes.
You've heard the questions from our viewers. For the purposes of confidential matters, they did not want to appear on cameras. But you've had the question,
Yes,
some of which I think you talked about in as far as myopia is concerned.
Yeah.
But I need you to widen it up. Are refractive errors genetic, and can they lead to total blindness?
Yeah, thank you very much. That's a good question. I think I mentioned some bit of it in a few minutes ago. Yeah, commonly they are genetic, though it can occur from nowhere with no family
You
history.
explained that.
Yes.
So this second part
The
of
blindness.
the question, can they lead to total blindness?
They cannot lead to total blindness per se, but they can cause serious visual impairment, and serious visual impairment in the sense that you don't function well as a person with bad vision. Okay?
Okay.
You can't drive with a high myopia. In some, like high myopia, you've seen people with very thick glasses, very thick. That could be a patient with very high myopia, very high refractive error. These ones are prone to, they can actually get blind, because if someone who has high myopia, they are prone to some complications like retinal detachment. They can have the retina is detached from the eye,
Okay.
and this can cause total blindness.
Okay.
It is rare, but it can occur, especially in high myopia. The other bit is, it really causes total blindness, but it causes serious visual impairment.
Okay. Another question was, we are
Was
good at using
using
the phone.
phones,
You have a smartphone.
yeah.
I'm on a laptop. Some of us enjoy watching TVs in the darkness.
True.
We enjoy watching movies in the dark. That's why most of the people go in the cinemas where all the lights are off,
Yeah.
and they are close to the screens or the projectors. So can this cause refractive errors?
Yeah, this is a good question, and it's an issue of concern with this trend of computer age.
Computer and smartphones.
Everyone has a computer close to them. Everyone has a smartphone. Everyone has a laptop. In those days, it was rare. Some research is going on, and someone had a conclusion in their study, and they say that by the year 2040, most of us will be, those who live up that time will be short-sighted, will be myopic.
Okay.
Why? Because of getting used to near vision. If you're using your smartphone, using your computer, that's near vision most of the time. Just like someone who goes to the gym and keeps on lifting heavy weights, with time you'll get muscles, muscular. The muscles that help us in focusing
so
near.
using your phone regularly, your laptops, you're training your eyes
To be short-sighted.
Oh.
Yeah, which is actually a behavioral kind of way of getting short-sighted, which is not nice. So in our approach to that, we don't encourage someone to stay on a computer for so long, for many hours, without looking at this far. Using your phone for an hour. These days, people watch movies on the phone. A 2-hour movie, someone is watching
On the phone.
continuously. By the time you finish and look ahead, you look far, you will see vision is a bit blurry because your eyes are focused. So if you spend most of the hours of the day for a long period of time, of years, looking at near screens, you may get short-sighted with time.
Okay.
There's no confirmatory, it's not confirmed, but it's actually very common. Children who are too much indoors, who don't go out to play, are prone to developing short-sightedness later in life.
Okay.
So phones, laptops, they predispose us to getting myopic.
Okay. Thanks a lot, Doctor. Is there any risk of not detecting ametropia in babies?
Pardon?
Is there any risk of not detecting ametropia in babies?
It's difficult to detect
Because
ametropia
they
in baby.
neither use smartphones nor sit on laptops, something like that.
Actually, babies, we encourage that they should spend some time in areas with bright colors.
Okay.
We encourage them to do outdoor activities to prevent them from developing some refractive errors. So a baby or a young child who is actually not exposed to such environments that I've talked about, they are prone. It's risky for them. They can actually get refractive errors.
Okay.
But I told you earlier, genetics play a very big role. If you're myopic, if you're short-sighted, or if you're going to marry someone, you should find out if they are short-sighted. If they are, be prepared of having a child who is short-sighted.
Okay.
So you as a parent who is short-sighted, when your child is young, you should watch out for that. So this risk of having family sort of myopia can predispose your child to developing it.
Okay.
So the environment bit is actually, behavior. Make sure they play in outdoors. They should not spend much time on screen. That can prevent them from developing refractive errors.
Doctor, you talked about blurry vision as one of the symptoms of ametropia.
True.
Can you tell us more of the symptoms?
The symptoms. So someone who has ametropia, especially hypermetropia or astigmatism, they don't see things clearly. Something you see clearly, for them, they see some shades on it, okay? Especially for things at a distance. If they are reading, they strain. So our eyes can focus something for some good time. You can strain. Just like you lift something heavy weight, at some point you feel fatigue coming up slowly and you lose energy like that. So the muscles that are responsible for focusing actually also get fatigue. When this fatigue sets in, you lose focus slowly, so things become blurry.
So with fatigue, you mean they get tired?
They get tired of straining. Ideally, normal eye should focus in microseconds. If I'm looking here, in microseconds I can turn and look at a distance without any strain. Someone with refractive error or ametropia, they can strain for some good time, but they cannot withstand the strain for long.
Okay.
So in the strain, when fatigue comes in, then things become blurry. Okay?
Okay.
So someone says, when I'm watching something for some time, I see clearly, but later things now mix up. That is refractive error mostly.
Okay.
Yeah.
Another symptom.
Another symptom, of course, I told you in hyperopia, they have headaches, they have brow aches. Someone has pain deep there in the eye,
Okay.
or around the temples, or the headache. And this pain goes away if they rest. If someone takes rest, it goes away. So why? Because if they rest, they're not using their eyes, they're not straining anymore. So someone has headache, has eye strain during day. At night, there's no pain because they are resting.
Okay.
So headache is one of the symptoms. Eye strain, you feel strain in your eyes in seeing. Sometimes even light sensitivity, bright light, things are not okay. You're not comfortable with light. So those are the common signs of refractive errors. For myopia, it is so special. Someone sees well at near distance. When things go far, problems.
Okay.
Yeah.
Now let's go to the correction of ametropia. How can one correct ametropia?
Ametropia. So ametropia, in simple terms, is like someone who is lame. Someone who has polio. You've heard that?
Yes.
Someone has had an accident and they need some aid, some crutches to support themselves.
Some enhancement.
Yes, enhancement.
Something that can help.
Yeah. So someone who has a refractive error or someone who has ametropia, they need aid, some visual aids to help them focus well. Ametropia is not an infection, okay? So we have to use optical devices to correct. So we need to use glasses, lenses. We have to measure and first of all know which error you have, and then correction for the refractive error. And we use optical devices, which are lenses, to correct this. So someone has a refractive error, they need glasses. They need specs,
Okay.
which is the cheapest form of visual aid. Specs don't actually damage some people's eyes.
Oh.
People have a wrong misconception about spectacles. They think,
That's the misconception.
they
I
think
had.
if you put on glasses, your eyes actually worsen. No, it's not true. If someone uses glasses, they actually appreciate the beauty they have been missing. So with glasses, they see clearly. Without them, they
Doctor,
go.
how about if I have my eyes are okay and I put on glasses for long-sighted people?
For example, me, I'm not long-sighted. I'm not short-sighted, but I use glasses. These are protective against bad light and computer light. I also use them if I'm outside in the sun. I don't have refractive error. If you use the wrong glasses, if you're not short-sighted and you're using glasses for those who are short-sighted, then you're damaging your eyes.
Okay.
Because you actually cause strain. Your eyes are normal and you're putting on plus lenses. It means you will have a blurry image, and for you, you will actually strain your eyes to try to focus well. So the hallmark is, don't use glasses that don't correct your refractive error. You have to undergo an eye check. We call it refraction. Make sure you get to know if you have refractive error, and then correction for that.
Okay.
Each one has their own prescription. And mind you, each eye could have a different correction. That's why you cover one eye, measure it, then cover the other eye. So if you get the right correcting lenses, you actually have good vision. So one of the ways of treating it is spectacles, the cheapest actually. Though they're expensive, but the cheapest.
Okay.
The other one is contact lenses. These are put on the eye, onto the eye. They are very good for sports, but they have high maintenance costs.
Okay.
They are not good for environments that are dusty. You have to keep changing every month sometimes. And if you have complications from contact lenses, they are very serious.
Okay.
So they need someone who is very disciplined and has enough money to maintain. So there are also lenses in those contact lenses, and they are aimed at correcting your vision. The other way of treating refractive errors is surgery. You can have what we call lens exchange surgery. If someone has high myopia, we can go in and remove the natural lens, okay, and put in a low power lens that corrects this myopia. Or we can do what we call refractive surgeries that involve changing the shape of the cornea so that someone does that with the glasses. Okay? So those are the main options of treating refractive errors: spectacles, contact lenses, and refractive surgeries.
Surgery.
Yep.
Doctor, you talked about myopia, and when you talked about myopia, I got worried. It can be genetically transferred to our children or our loved ones, and this worries me a lot.
You shouldn't worry.
Brings me to a question.
Yes.
Can ametropia be prevented?
Some causes of ametropia can be averted. If you have injury to the eye, you can actually get ametropia. If you have a corneal injury that heals with a scar, that scar may distort the shape of the eye and you can have ametropia. So by having protective wear in risky environments like construction sites, if you're on a motorcycle, to avoid any accidents or any trauma to the eye, you are preventing ametropia. However, most of the ametropia may not easily be preventable, especially the genetic type. You cannot fight your genetics. Okay, if your mother transmits
you
genes,
can't fight it within the womb of the mother.
You cannot fight it. If your mother transmits to you genes of myopia, you cannot change that. If your father transmits hyperopia to you, you don't have control over that.
You just can't try to cure it through the surgeries.
You can, through surgeries. Maybe one way you can prevent that is if you're not hyperopia, if you're not myopic, and you want to marry someone,
you have to.
You can ask about if they have refractive error. That is very rare. You know?
Okay, doctor, thanks a lot. It has been a pleasure having you in these two programs.
It's a pleasure
and
too.
Please always honor our invitations whenever we call upon. We send a call for you to come and have a view or a help to deliver to our viewers. Thanks a lot for honoring this one, and we are looking forward to working with you in the next program. Our viewer, we can't go beyond this because this is all what time could allow us. I remain your host, Nambali Bashir. Until we meet in the next episodes, Assalamu alaikum wa rahmatullahi wa barakatuh.
You